And Chuck is the Physician Recruitment and Fundraising Coordinator. He's a Dryden resident of 48 years and currently works in the role of Physician Recruitment and Fundraising Coordinator for the Regional Health Centre. A self-described Northern Ontario fanatic, Chuck works in a variety of volunteer and professional capacities to give back to the community that has given so much during his formative years. Kim, Chuck?
So I'm low tech. I have no slideshow, just some scribbled notes here that I'd share with you. So can everybody hear me? All right. So a couple things I want to talk to you about today, and one sort of, I think what I'm going to do is give you a bit of a recruitment update on the physician state over at the hospital and the clinic. And this ties in with some of the things that Kim was talking about in delivering and coordinating care. So right now, like we may, or as you may or may not know, Dr. Mazurski and Dr. Whitaker have retired. And so with that, we haven't replaced those positions yet. There's 2,400 patients that have to be, have been distributed amongst the existing physician group there. So that's put a lot of extra pressure on the physicians in the clinic. We have one nurse practitioner that's currently off work and with a healthcare condition. We have one physician that's going to be on paternity leave this summer, which is good news. And we have another physician that's just coming back from surgery. So it's a bit of a perfect storm. And as some of you may have experienced, it's hard to get into the clinic right now, and it's it's a you know, sometimes it's a contentious issue, and people ask questions quite often about that. And I just wanted to share with you the math on that right now. So the group is working extremely hard. They don't just work in the clinic. They provide home visits. They go to Patricia Gardens. They work in Emerge, surgical assistant. So our group is taxed. They're working very hard. But to support that, my role as physician coordinator or recruitment coordinator is, you know, we're not seeing a lot of things right now. We haven't heard about any new hires. But I can tell you right now, we're very close with two people. We work very closely with the Northern Ontario School of Medicine in Thunder Bay, and we have a regular stream of learners that come through. I can tell you right now that one physician has been back to Dryden 5 times. He has a contract on his table, and he's looking at it, and we expect to hear back very soon. And tomorrow, I have a physician that's visiting from Flin Flon, Manitoba. I'm interested in family, OB, and emerge work. So so the cavalry is coming. So just hang on there. Is something that I wanted to share with you right now. We're at a bit of a low ebb, and I just wanted to pump the tires here a little bit and assure you that we're working tirelessly. There's a couple people from Dryden that are currently enrolled in medical school training in residency programs. One's out on the East Coast and one's at the University of Manitoba. And they've expressed an interest in coming back here. So we have our fingers in the pie all over the place, and you have to plant seeds far and wide and think about. Mel Fisher was talking earlier in his role as with the town engineer. You got to be thinking ahead, and we are thinking ahead. So you may not be seeing and hearing much, but I'm telling you, there are things that are going to happen. So hang on there. Okay. So the other thing I want to talk to you about, and this is a bit of Wade's message today, was the fundraising status in our financial picture at the hospital. So, and you may have heard of a little bit of the health care levy thing. Thank you for not throwing mud. That was a kind of a contentious notion, and I'll tell you a little bit about the spirit behind that idea. So currently the hospital is generally, we receive 1% global increases to our finances for the year. So, but we face inflationary pressures that run in the area of 3 to 4%. So, you know, if you do the math quickly, we've been losing ground for a number of years, and we've gone from generating very healthy surpluses that we've ruled into physician recruitment and capital acquisitions to the point where now on a $25 million budget, we have an $11,000 surplus for this year, which is still really good. We're running in the black, and as Kim alluded to, we have very strong leadership. And financial stewardship is very important to the health of our healthcare system here, and we do a very good job of that. But there's a lot of pressure, and so you know, we have a shrinking surpluses, limited revenue streams, and increased costs, and that's the general story for healthcare right across the province, and that's what's driving the Health Hub project. And I know I'm using dated terminology there, but But anyways, so we're always looking at efficiencies. From the fundraising perspective here in Dryden, we face some interesting challenges. From a corporate support level here, a lot of the programs, national chains have national programs where dollars are provided, from corporations that go to, projects and larger larger constructs outside of Dryden. So like Ronald McDonald House and things like that, they don't, those corporate dollars aren't coming back to our community. So we don't have a lot of corporate support. Our local economy is challenged, as we all know. And there's hundreds of good causes, and you can't go very far without somebody fundraising. And I'm looking at you, Marty Plum. You've done a fantastic job. Like, look what you did, this weekend. And I think we should all put our hands together for what Marty and her group did. Yeah, phenomenal, but incredible amount of work goes into that. So we proposed this healthcare levy thing to kind of help stabilize our financial ship, and we just wanted some income certainty. So unless you've been living under a rock, I'll kind of give you the quick and short of it. It was $1.50 per household, and we went to Vermilion Bay, and we went to the city, and we went to Ignace, and we're going to the First Nations, and we're trying to figure out a way the unincorporated can contribute to this global pool to help support the hospital, and it goes towards capital. Those dollars were supposed to go towards capital projects. And that's like equipment only, not operational expenses. So that was squashed at the municipal level here. Although in Ignace, it was funny. I went there to present to council, and it was I went right after the contentious garbage tag issue. So they're implementing garbage tag, $1.50 per pickup, or you can still take your garbage to the dump there for free, which is a good deal. But it was packed, and people were angry. And I'm sitting there, and I'm looking, and I'm thinking, oh yeah, here I go. I'm going to ask for some money now. But it was really refreshing because I gave the pitch, and the council said, right there, we're in. Like, we'll do it. It's our hospital too, and that was really refreshing. And I'm not slagging city council here because we all know they've had a hard time righting the financial ship. They've had to make some very tough decisions, and Shane, you're part of that. You know that story. But there's a bigger thing that's looming, and it's really critical to the operation of our hospital and healthcare here, and that's the replacement of our CT scan fund, which is the next conversation I'm going to have with the city. Leadership there has said that we'll entertain a further discussion, and to replace the CT, that's $1.2 million, and that's like a 6-7 years away. I know in our economy right now, there is no way I'm going to raise $1.2 million. So the idea is, the semantics, the wording of a levy was deemed illegal, although we have differing opinions on that. I'm going to go back to the city, and we're going to talk about how we can do that in order to replace that CT scan, because that is a critical anchor to recruitment and retention of our existing physicians and future physicians. It's a huge diagnostic tool for cancer diagnosis, for people with appendicitis and internal issues. And we used to send out 2,500 people a year for CT scans. And if you have a stroke in our community and you don't have a CT, we got some real problems. So that's the story behind that. There's a sort of a greater overarching idea that Wade has, and I want to just run that past you a little bit today. I went to the Lake of the Woods Community Foundation presentation. They have their gifting ceremony, and as you may or may not know, they have a community foundation where it's like a United Way of Kenora, and it took them 15 years to get it established. And what they do is they raise money, and they distribute the interest every year. And it was a wonderful service, and where they gave away over $120,000 to local charitable causes. And so we're looking at that as something down the road that maybe we can start to plant the seeds and strategize and bring some people together and distribute some of the dollars that we can raise locally amongst the groups that really need to use that. And I'm not just talking about healthcare when I say that. So that's something that Wade has tasked us with, and we're going to be moving that forward. So that's a bigger picture, and it's a longer term vision for our community. But I just wanted today to tell you a little bit again about the recruitment and reassure you that we are working hard and we are going to have some success, and you're going to have better access to primary care here, and into the Emerge department. When we have more people working in the clinic, there's less people going over to the Emerge, and that's what's happening right now. So wait times are kind of going up. And the other thing, and this is a bit of a shaming statistic, but did you know, like, on any given month, anywhere from 60 to 100 people don't show up for appointments, even though they get called? So, so if you see or if you hear anybody that says, "Oh, I missed my appointment today," you shake your finger and say, "Oh, you're hurting us," because that's a horrific waste of a resource when we have people that need to get in there, and it's very frustrating. So, anyways, if you had any questions, I'm happy to chat with you about that. But I thank you for your time, and I have to thank you again. Like, this is a room full of great people, and I'm not just saying that because I want money. But you've been so good. And the last time I spoke when Adam came, like, I was really like, it's really good work that you do here, and you're touching the people in our community in a really profound way. So I can't thank you enough for that. Like, but I'll try. Okay. All right. So thanks so much for your time.